This is an instructional video for Target Tape's X-Line radiotherapy device. X-Line is a precision radiotherapy tape that solves CT simulation image distortion among obese cancer patients. If your CT simulator has an extended field of view option, much of the information in this region is likely missing or distorted, leading to suboptimal radiation treatment planning. The image on the right should be a perfect circle. However, distortion in the extended field of view has disguised the true outline, making it impossible to know the correct source surface distance. Clinics with GE Lightspeed RT and Siemens Somatom radiotherapy series models, or any other CT simulator with an extended field of view, would greatly benefit from X-Line. X-Line consists of 3 radiopaque lines on an adhesive strip, creating a series of reliable, hyperdense dots in the resulting CT image. For patients imaged within a CT simulator's extended field of view, this provides more accurate information about the true location of the skin boundary. Better information leads to better contouring. It's that simple. X-Line is applied by the radiation therapy team, with the improved body contour helping the dosimetry and medical physics teams. During CT simulation, the radiation therapist will first identify large patients who need X-Line in order to be imaged correctly, peel the adhesive strips, apply X-Line longitudinally to the region of interest, and perform the CT scan as usual. Then, the medical physicist or dosimetrist will connect the hyperdense dots created by X-Line in order to accurately identify the skin boundary in the CT image. Patients larger than 50 centimeters or 20 inches at their widest will need X-Line. This is typically anyone heavier than 275 pounds. Anything within the extended field of view should be covered with X-Line. For patients with the waist circumference or pant size of 46 to 48 inches, we suggest using 2 strips per side. The larger the patient, the more of their body is likely to appear distorted within the extended field of view, so extremely large patients may require as many as 8 strips of X-Line on each side of their body. Refer to the following table for landmarks and strip lengths for some common procedures. Another way to identify patients is to lie them down on the tabletop and look down the longitudinal axis. Most tabletops are about 50 centimeters or 20 inches wide, so any regions protruding over the edges of the tabletop will need X-Line. If your clinic requested a patient measurement ruler, the ruler can be folded down over the patient as shown. With 5 10-centimeter segments centered over the patient's body at their widest point, any regions that make contact with the folded segments will require X-Line in order to be imaged accurately within your CT simulator's extended field of view. Pull strips of the appropriate length out of the box. X-Line is perforated every 2 inches to allow for easy dispensing. Then, make use of the kiss cut feature on the back of the strips to expose X-Line's adhesive. X-Line is easy to apply. The radiation therapist will position the patient as normal and then stick the tape directly on the patient's skin, parallel to the tabletop. Be sure to cover the entire region of interest. When applying multiple strips, make sure to leave a gap no larger than 1 inch between each strip. Finally, perform the CT scan as usual, removing and discarding X-Line when finished. Once the patient has been scanned by the CT simulator, your clinic's dosimetrists and physicists will be able to connect underneath the hyperdense dots, the pink line, to create an accurate contour of their skin boundary. Compared to traditional extended field of view reconstruction techniques, the blue line, this enables more accurate source surface distance calculations and consequently, better treatment plans. X-Line is now available. The standard length is a 50-foot roll, accommodating between 6 and 8 procedures depending on the size of your patients. Please visit us online or call us to place an order or to be referred to our distributor. And of course, if you have any questions, please get in touch with us and we'll do our best to help you. X-Line radiopaque adhesive. Easy, accurate body contouring for obese cancer patients.